Katherine Alexander. Today's date is 6/28/2014. This is my health assessment video for Nursing 518, Section 820, Dr. Pam Johnson. This is my patient. Can you tell me your name and date of birth?
Mandy Atkinson, July 22nd, 1986.
Okay, and do you consent to have me do this video today?
Yes.
Alright. Mandy, can you tell me what time of day it is?
It is 3:45.
Okay, and where are we at right now?
NUSC.
And who am I?
Katherine Alexander.
Okay, so patient is alert and oriented ×3 to person, time, and place. I'm going to give you 4 words, and I want you to repeat them back to me.
Okay.
Beach, house, dog, blue.
Beach, house, dog, blue.
Perfect. Repeat them one more time.
Beach, house, dog, blue.
Perfect. I'm going to have you repeat those back to me in a little bit, okay?
Okay.
But immediate memory intact. What did you have for breakfast this morning?
A biscuit.
So recent memory intact. Where did you go to high school?
Mullins High School.
Remote memory intact. If you were in a store and somebody said, hold the door for me, what would you do?
Hold the door.
Okay. So judgment intact. If I gave you the analogy, an apple a day keeps the doctor away, what does that mean?
It means eating healthier keeps you healthier.
Perfect. So abstract reasoning intact. How have you been feeling lately?
Good.
And today?
Doing well.
Okay. We're going to do a calculation.
Okay.
100 minus 5.
95.
And minus 5 one more time.
90.
Okay. Patient able to calculate. I'm going to have you do a movement with your hands.
Okay.
So on both hands, I want you to do this. Finger to thumb, like this.
Mm-hmm.
On both hands. And if you can do them at the same time.
Same time?
Yep. And back again. Perfect. Intrinsic movement intact. Now I'm going to have you touch a finger to your nose and follow my finger.
Okay.
Perfect. Alright, now we're going to assess your cranial nerves.
Okay.
There's 12 of those. Cranial nerve 1 is your olfactory.
Okay.
So what I'm going to have you do is close your eyes and occlude one there.
Okay.
And I'm going to give you a smell and you're going to identify it for me.
Okay.
Smell?
Vanilla.
Perfect. Alright, now we're going to do it with the other side. You're going to occlude your other nail with your finger.
Okay.
Smell?
Vanilla again.
Okay. Cranial nerve 1, olfactory, is intact. Cranial nerve 2 is optic. I'm going to have you take this eye card and hold it at arm's length and read the smallest line possible.
Okay. 937826 WMEXOO41.
And can you point to which one you just read?
This one.
Okay. So patient is 20/30 with vision. So cranial nerve 2 optic is intact. The next cranial nerve 3 is ocular motor. So I'm going to assess your pupil size and perla. Pupils equal reactive light accommodation. So I'm going to have you look straight ahead.
Okay.
One more time. Alright. Patient has a pupil size of 3. And pupils are equal, round, and reactive, and they accommodate to light. So cranial nerve 3 is intact. Cranial nerves 4 and 5 are the trochlear and the abducen, and I'm going to have you follow my finger.
Okay.
Alright, so pupils are able to follow lateral and inward eye movements. So cranial nerves 4 and 6 are intact. Cranial nerve 5 is the trigeminal nerve. I'm going to have you clench your teeth for me, and I'm going to feel equal on both sides. Alright, now I'm going to have you close your eyes, and I'm going to do a cotton swipe on your face, and you tell me when you can feel it.
Okay. Good. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay. Patient's trigeminal nerve, cranial nerve 5 is intact. Cranial nerve 7 is the facial nerve. So I'm going to have you smile and frown and puff out your cheeks and raise your eyebrows. Perfect. So cranial nerve 7, facial is intact. The next one we're going to do is acoustic, cranial nerve 8. So I'm going to whisper 3 words to you, and you tell me what you hear.
Okay. Bell, house, bird.
Perfect. So cranial nerve 8, acoustic is intact. We're now going to do the Ryan and Weber test with that. The first one is the Weber test. So I'm going to put this on the center of your head, and you tell me where you hear the noise best, if one ear is better than the other.
Okay. I hear it equally.
Equally. Perfect. So Weber test intact. Now we're going to do the Ryan test. I'm going to put this tuning fork behind your ear to test for bony conduction, and then move it to the front to test for air conduction of your hearing.
Okay.
So when I place it behind your ear, let me know if you can hear it and when you stop hearing it.
Okay. I hear it.
And tell me when it stops.
It stopped.
Okay. Do you hear that?
Mm-hmm.
And tell me when it stops.
It stopped.
All right. So patients' air conduction is twice as long as bony conduction. So cranial nerve, the acoustic cranial nerve is intact. Next, we're going to test cranial nerves 9 and 10, the glossopharyngeal and the vagus. And for that, I'm going to look in your mouth, and I want you to say ah. One more time. Ah. Come down. Perfect. Uvula is symmetrical, and the soft palate raises equally. Next, we're going to test the gag reflex. Can you open up? All right. Okay. Gag reflex intact. Cranial nerves 9 and 10. Cranial nerve 11 is your spinal accessory. I'm going to have you sit up. All right. I'm going to have you push up against my hands. Perfect. And push against my hand. Turn your face. Perfect. And one more time. Perfect. Spinal nerve, cranial nerve 11, spinal accessory is intact. I'm going to have you lay back down. And the last one is cranial nerve 12, which is the hypoglossal. So I'm going to have you stick out your tongue and put it up to your nose and down to your chin. Perfect. Cranial nerve 12 is intact. Next, I'm going to have you stand up on the side of the bed and walk to the end of the bed and back.
Okay.
And back again. Perfect. Gait is intact. Next, we're going to do the Romberger test. You're going to stand with your feet together, close your eyes, and raise your hands. All right, perfect. You can sit back down. Romberger test is intact. Next, we're going to do your deep tendon reflexes. I'm going to start with your patellar and your Achilles while you're laying down.
Okay.
So I'm going to put your leg out like this. +2. +2 for Achilles. Next, we're going to do, I'm going to have you sit up a little bit. We're going to do your bicep and tricep. So bicep, this is for the tricep. Hang a little bit more. Like rest on my hand. Tricep, deep tendon reflex intact with a +2. And then we're going to do the bicep. +2 intact. Next, I'm going to palpate your radial pulses. Equal +2. Then I'm going to do your dorsal. Equal +2. Capricel less than 3. And then we're going to do your Achilles pulse right here. +2. Perfect. All right, next we're going to look at your stomach. So if we can put your shirt up a little bit, then we'll... So we're going to inspect for contours, shapes, no masses, light palpitation, and then deeper palpation, no masses. All right, you're going to listen to vowel sounds. Positive vowel sounds in all 4 quadrants. We're going to palpate for the spleen. So I'm going to have you turn this way just a little bit towards me. Spleen, non-palpable. Okay, lay back down. And then we're going to palpate for the kidney on the right side. Non-palpable. And we're also going to go ahead and start palpating for the liver. Non-palpable at the costal margin. All right, next I'm going to percuss for your liver borders. All right, lower border. And upper border. We're going to measure that. 6 centimeters, which is normal. Next, we're going to look for any jugular vein distension. So I'm going to take this pillow out from under your head and look. No jugular vein distension. Next, I'm going to look for the carotid, palpate for the carotid arteries. And then I'm going to list for any bruits. No bruise noted. Next, we're going to listen to heart sounds. The aortic and the pulmonary are the best place to hear S2. The aortic is located on the right side, second intercostal space to the midsternal border, and the pulmonic is on the left midsternal border, second intercostal space. All right, and then we're going to go down to the fifth intercostal space, mid-clavicular line, to listen to the mitral valve. So I'm going to have you just right here. Perfect. And this is the mitral valve where you hear S1 the best. Perfect. And then we're going to look for the apical impulse. Which is the apex of the heart where you can see the heart. And then I'm going to listen at the aorta. All right. Mandy, can you recall those 4 words I gave you earlier?
Beach house dog blue.
All right. And that concludes our video today. Thank you for letting me do the assessment on you. And now I'm going to give you a view of the room.